Our first speaker is Alwyn. Alwyn Diaz was diagnosed with NF at the age of 4 years and has lived with NF and has been through many things related to NF that I'm sure he'll tell us more about, but his focus and goal is to support individuals in realizing their true authentic leadership ability. Alwyn, thanks for coming.
Hey guys. This is my first forum that I've ever been to, and it actually is the first time that I've been in a room with so many people that share my condition, and it's just impressive to see all the love and all the care and all the support and energy behind all of it, so I'm just blessed to be a part of it. So I was born with NF at the age of 4 years old, and my parents were immigrants to the country when they found out, and my mom says that when she found out, she got to a payphone in New York and called my father and said, your son has neurofibromatosis. And my dad was just like, okay, so do we have to get medication? And she was like, I don't know. I don't even know what to do. And so from then going forward in New York, I was either going to a hospital or I was going to a church. And it was either God was going to fix this for me or a doctor was going to figure it out. So I was going through that, and a lot of the times it was about hiding the fact that I had NF. I was saying to somebody before that I have a pretty large tumor in my chest, and children would ask me about it, but my mom would say, just tell them it's an extra muscle. And I'm thinking, all right, I'm just going to do that. So that mentality of hiding this condition really went into, when I turned 21 and started to take care of myself, I neglected it completely. Until about the age of 37, where I fell, and I was dating my girlfriend at the time, and I started to feel numbness in my legs shortly thereafter. Now again, having NF, it's a pain, you feel weird things from time to time. I'm just thinking, it's just part of the condition, I'm fine. My girlfriend was just like, have you gone to the doctor? I said no. And then a week later she said, have you gone to the doctor? I said no. And she was, what is going on with you? So I finally made a call to NYU Langone and found out that I had an orange-sized tumor impacting my spine, and within a couple days I was paralyzed from the chest down. The conversations I was having with doctors and physicians were that, do I live in a one-floor household? Do I live with anybody? What kind of care do I have at home? And I'm thinking, right, life is going to be me in a wheelchair. After a number of tests and the wonderful care that I got from NYU Langone, I had an orange-sized tumor against my spine. They removed it. And just a couple months ago, I just don't need a cane anymore. So I went from a wheelchair to a walker, to crutches, to a cane, and now I'm walking. And in that entire time, if I didn't start to care for myself and find the love for myself, I would never have taken a step forward. And taking a step forward, I only needed to take an inch forward in it. And within 2 years of having that surgery, I'm sitting here in front of you guys. I'm totally embedded with CTF, which is a blessing. I'm caring for my life and my future. I married the girl that was my girlfriend that stayed with me through it all. And the learning that I have from all of it is that as soon as you have a point of self-awareness and love for yourself, and caring for yourself, and then there's this feeling that you just take a step forward, like an inch forward, and then you realize that there's so much love around you. It's not something you have to deal with in yourself. And so I took that inch forward, like I said before, and oh my God, and I'm here in front of you, there's CTF, there's my doctors, there's so much research, which you'll hear later in the day. And my message is just take that step forward and realize there's so many resources in front of you, and engage in them. Don't stray away from them. Take action in terms of looking at your condition, your son's condition, your daughter's condition, and just diving in, because by doing that, you learn about what the condition is, you learn about your own self-empowerment, but then your children are able to champion it. Now remember, I was the child that thought I had a big muscle on my chest. All the while thinking if I had the condition, I wouldn't be so confused and sort of uncomfortable with it. One of the things I've said to a lot of people is when I see shirts with NF, I'm thinking, oh my God, we're supposed to be hiding this. Why are you wearing the shirts? And if I was to have that when I was 4 years old, I wouldn't think I was so different. So I grew up in a non-diverse community. I was the only person of color. I was really the only person of color in my entire school. And then on top of it, I had an F. So like, how far different could I possibly be? But if I had this community then, I'd feel so much more grounded in the life that I have. So, and the one thing that I wanted to recognize is there's so many fathers and mothers in this room that I've met over the last couple days, and you guys are amazing. I mean, phenomenal. The love that you guys all have is outstanding. And, you know, I owe everything that I have to my parents, and they did it by themselves. And I think about the strength they had, but all of you are here together and you have this community, so please stay together and please know that you're doing so much for your kids and you're allowing them to feel normal, which is hard to begin with. One of those mothers, which is going to be coming up next to speak with you, was Sarah Adsit. And I just want to give the mothers and the fathers a round of applause and really give you guys credit for this. Because if it wasn't for parents like yourselves and mine, you know, I'm not sure where I'd be. So I'm going to leave it to Sarah because she's pretty awesome. And you guys have heard her name quite a bit throughout this event. So please give it up for Sarah.
Thank you, Alwyn. So it's been my pleasure to sit on this planning committee. When I was approached to do this by Trace Ann last year, I jumped at the opportunity. In my day life, I'm a physician assistant. I practice nephrology, and for those who don't know, that's the study of kidneys. So I take care of a lot of very sick, complicated patients, but you don't have to be a PA or in medicine to be able to do any of this stuff, so keep that in mind. So my story with NF began as many of you in this room, sitting across a medical exam room from a stranger in a white coat, telling me my daughter had neurofibromatosis type 1. He went on to explain that there was no cure and no effective treatments for this disorder, and that all he could offer me was to watch and wait. I remember looking down at my daughter as she was playing at my feet and thinking, this is unacceptable. Like, how can I not do anything? Just watch her. Time went by, and the only thing I was certain of was the unpredictability of NF and the absolute torture of the watch and wait. So Emerson's diagnosis had a very major impact on our family, not just her father and I, but her two older brothers. And we spent a lot of time searching for ways to help our stress and to help manage our fear. By the age of 5, Emerson has been diagnosed with many tumors, including an optic glioma, a paraspinal plexiform tumor, and a brainstem lesion. She's had countless MRIs, surgeries, chronic pain, seizures, functional impairments, invasive and non-invasive tests, and the list could really go on. You guys all know. She's had all of this stuff before ever setting foot in a kindergarten classroom. And we consider her the lucky one. So in this journey, I've met lots of you and very compelling stories. One recent story that I've come in contact with is a local mother in my area in Wyoming who had a baby. She's 21, had a baby and discovered that her plexiforms in her pelvis and back had quadrupled in size. She was left paralyzed at the hospital after delivering her baby. She's seen multiple specialists and has no treatment options. There's another young child that I've come in contact with who has a brainstem glioma, who has exhausted all chemotherapy options, and his mother is talking about palliative care at the age of 10. And there are so many other stories out there that are very similar. Hearing these stories, I was compelled to do more than watch and wait. My family and friends began fundraising to help fund NF research to help better treatment options. We became part of something bigger than NF. As you heard, some of you heard in Dr. Korf's talk yesterday afternoon, there have been many advances in the understanding and treatments of neurofibromatosis in recent years, but there's still much to accomplish. As a parent and a patient with NF, we have the unique knowledge of the true impact and burden of living with neurofibromatosis. But knowing is not enough. We must apply and share this knowledge if we are going to affect change. Wishing for a cure or treatment won't develop one. We have to act. The National Organization for Rare Diseases recognizes neurofibromatosis as a rare disease. Rare disease means fewer patients, fewer clinicians, fewer researchers. Oftentimes, with rare disease, it is the patients that are the driving force behind the advances in research. Everyone in this room has the knowledge, the power, and the ability to drive research. We can guide clinical researchers towards specific conditions or symptoms with NF. We can sit on advisory panels. We can push for standardization and protocols to improve patient experiences within the NF clinics. We can influence researchers to investigate aspects of NF that have been previously misunderstood. We can help to guide development of better testing, improved surgical outcomes, and effective treatment options. And there are many more opportunities to act. Fear grows while we wait and watch, but as we can overcome our fears with action, and the time for action is now. The time to become a driving force in NF research is now. There are too many children and adults with NF that are left without treatment options, and this is unacceptable. Too many within our NF community are left suffering. I will leave you with one of my favorite quotes from the late Steve Jobs. "The people who are crazy enough to think they can change the world are the ones who actually do. Let's change the world."